everybody. Welcome back to Crafting and Crying Daily. I gotta remember when I'm recording these shows to press the record button, or you have to do it over. So I wore my duck t-shirt today. Got any greats? In honor of all the rain that we are having, I'm Rebecca. I'm your host for this recap of day 22 of the Maya Kowalski versus John Hopkins Children's Hospital case. I am working on a second Halloween painting. The first one, the pumpkin that you saw yesterday, I finished that one, except for the upper right, God, the upper right corner, where all that silver is. That I want to fill in some bats and things, and I'll do that probably on Sunday's live. When I got my girl Jen with me, and maybe we'll finish it up together. She's working on the same painting. So I got my other Halloween, same company, Crystal Canvas Art Designs. And you'll see that I started on the bottom and then I just working my way around. So I plan to get this done this week, maybe even more, because this is going pretty quickly. It's a lot of color blocking here. So I'm working this square right here, but you can see that I'm kind of going all the way around the border with it. Just kind of like how I like to diamond paint. Can you see the whole thing? Oh, you can. Look at the colors. Oh my God. They're stunning. I love this 995, 996 color, that blue. It is so pretty. Anyway, let me put all this back. I got everything going on here. The storage boxes, my notes, my phone, my breakfast dish, my coffee. Everything is over here. Oh, and before I forget, Slowpoke, he's holding all my diamond painting pins from a neighbor's outpost. Anyway, okay. Let's talk about day 22 of the Maya Kowalski case. But first, if you're new to the channel, welcome. I'm so glad to have you. This is the show where I recap live trials so you have something to listen to while you are crafting. I am going over the Kowalski case. I will also be covering later this week, once they pick a jury, the case of Charles Adelson, the South Florida periodontist, who is on trial for the murder of FSU law professor Dan Markel. Now, he didn't pull the trigger, but he is thought to be the mastermind of the hit that took place on Dan Markel. But if you want to see what that is in depth about that case while they're picking the jury, you're just curious, look at my video that I did on Monday. I'll try to link it here. So today we're going to talk about the Kowalski family, Jack the dad, Kyle the son, and the daughter, Maya Kowalski. They were all featured in the Netflix documentary. It's like a 90-minute film documentary about her adventures with complex regional pain syndrome and the impetus to this lawsuit. So it was called Take Care of Maya. If you want to take a look at that, it gives you a little insight into how this all came about. She was diagnosed with complex regional pain syndrome through her mom, Beata, who took her life during this whole episodic nightmare that they went through at John Hopkins Children's Hospital. So in October of 2016, Maya, who was staying with her father and mother at the Ronald McDonald House in St. Petersburg, a hurricane is approaching, but they're in St. Petersburg, even though they live in Venice, Florida, which is south of there, probably an hour and a half, 2 hours south of where they were. They were in town because Maya was receiving ketamine infusion treatments with Dr. Kirkpatrick, her treating doctor. So she had received one that day, but that night she gets extreme abdominal pain. Like she is, knees to her chest, just in agony. So her dad takes her to Johns Hopkins Children's Hospital emergency room. So when they get to the emergency room, at some point Beata comes along. Beata shows up there as well, and she is insisting that Beata Beata is insisting that Maya get 1,500 milligrams of ketamine infusion. And the ER doc's like, whoa, we have never heard of such a high dose of ketamine. So they actually called the treating doctor, Kirkpatrick, and he said, yeah, this is what we're doing. We're treating her. We gave her 1,300 today, or yesterday, and overnight. And so they're like, well, we don't do that here in the emergency room. So they transfer her to the pediatric intensive care unit under the care of the pediatric hospitalist, who is one of the witnesses that took the stand today. Very interesting woman. Lots to, she gets hammered on cross examination. And I'm going to show that to you. But now the plaintiff has finished putting on their case. They're claiming wrongful death, false imprisonment, fraudulent billing, because the hospital was billing for complex regional pain syndrome, because that's the diagnosis that was in the medical record. When you come into a place and you say, I have high blood pressure, that's what it gets put in the record. She's got high blood pressure. They don't ask somebody else. They just ask me, what's your medical history? So when Maya went into the hospital, they asked her family, what's her medical history, complex regional pain syndrome, and they put that in there. Now, the ER doctor suspected that that's not what it was, but it could have been. It could have been that, and she listed a whole bunch of other things that it could have been, none of which they have time to rule out in the emergency room. So they thought, okay, we're just going to transfer her to the pediatric intensive care unit, where if it's appropriate, they can put her on the ketamine infusion. They have the staff that can monitor there. They have the equipment. That we don't have all that in the emergency room. So they take her up there. Long story short, they eventually, someone reports possible child abuse, neglect, and exploitation to the Department of Children and Families, on the part of Beata, because she was a nurse, and she was advocating for her daughter. I'm telling you, this is what she gets. You know, ketamine is one of those drugs, and the doctor that they put on the stand yesterday, the expert, he explained ketamine. Um, it You don't necessarily withdraw from it, but in order for ketamine to work, you become dependent on it. In other words, you need more and more of it to get the same effect, which is not an addiction. It's just dependency. If you need that medication to control your pain, you're going to need more and more, higher and higher doses of it. But you would start them off at a very, very low dose. Um, from what I've seen of the history of this CRPS, Maya was only diagnosed with it in 2016, and they certainly didn't. Well, we'll get to that. The family did not. Well, I can't blame it on the family. The doctors that were treating Maya were not, according to this expert witness that the defense puts on, utilizing the standard of care treatment for CRPS. So DCF gets involved through a doctor named Dr. Sally Smith. Now, she is supposed to take the stand tomorrow. And man, I want to be a fly on the wall in that courtroom. Luckily, I'll get to watch it. Now, what I might do is record it and then show it to you guys live. And then we'll watch it together, maybe. Well, we'll see. What do you guys think? Want to watch it together tomorrow night? Dice it up together? Should be interesting. So the plaintiff has already finished putting on their case. Oh, I started to tell you. Sally Smith gets involved. She's from the Department of Children and Families. She has applied to the hospital and gotten staff privileges. She is not an employee of Johns Hopkins Children's Hospital. Most doctors aren't. Now, the hospitalist, she is an employee. But most doctors just have privileges at this hospital. That means they can go in and they can see patients. Well, Sally Smith, she comes along, she puts on her lab coat, she's got her little name tag, and then she'll just waltz into a room and start examining a patient like the hospitalist. They don't know who she is. You wouldn't know to ask. You just, oh, here's another doctor. And Sally Smith testimony has been she did not distinguish herself. She did not say, I'm from the Department of Children and Family Services, and I'm going to examine your child, and then I'm going to take your child away from you. Well, that's what happened. She examined Maya Kowalski, and based on her testimony, they open a case, they go in front of the dependency court, and the dependency court enters an order that she be removed from her parents and her brother and sheltered in that hospital until it's decided whether the hospital suspected mom was suffering from Munchausen's by proxy, which is where you deliberately make your child ill. Or the other thing that could have been going on is what they call a fictitious disorder, where Maya believes, her mind is telling her she's having all this pain, but she's really not. Either way, she's in pain. Either she has CRPS or fictitious disorder complex, she's in pain. You treat them both the same way. So, all right, then they have a dependency hearing, and this is in October that she goes in this hospital. She stays there for 87 days. In January, they have a dependency hearing where Beata again is denied visitation with her daughter, and she asks the court, can I give my daughter a hug? And the court says, no, you can't. So Beata goes home and takes her own life that night. So sad. In any case, the defense puts on their expert, Dr. Elliot Crane. He is world-renowned from the world-renowned CRPS program at Stanford University. University trained, board certified in pediatrics, board certified in anesthesiology, board certified in pediatric critical care medicine, and board certified in pain medicine. Yeah, I don't think they call it pain management. I think they just call it pain medicine. So he talked about what is complex regional pain syndrome, and he said it's regional. It generally starts in young children when they suffer. First of all, he says it's more common in young girls, and it's usually as a result of a sprain. And in this case, the testimony has been she may have sprained her ankle ice skating or gymnastics. I don't think it was gymnastics. She did them both. So in any case, um, he said, you have that pain from the sprain, and while it's healing, the pain kind of changes and becomes this neuropathic pain. And next thing you know, you've got this CRPS, complex regional pain syndrome. He said, there's no such thing as complex global pain syndrome. You don't have it over your whole body. Now, he says it can move. It can go to different limbs, but it's not going to go over to your both arms, both legs. It's not going to happen that way. Then he said treatment, the standard of care to treat these young children is physical therapy every day, occupational therapy every day, and I was struggle with this one. Cognitive behavioral therapy every day. Full court press, he says. You throw the full court press at them. Then if that does not work, then you can start them on very low doses of ketamine, like 1 milligram per kilogram. Now, he said Maya was getting 10 times that dose from Dr. Kirkpatrick. 10 times the recommended dose. Well, it's not recommended, standard of care. Then he was asked a question about FDA approval. And I don't know if this was on cross or direct, but he said, almost everything we do in pediatrics is not FDA approved. And I thought, oh, really? That's interesting. So, but going back to this full court press, he says, once you throw the full court press at him, if that doesn't work, it's a low dose of ketamine. He says, once you have it under control and it goes away, it almost never comes back in children. Now he distinguished this from adult CRPS. He says that is very different. So, and I think the difference here in this case is that when Maya's mom, you know, was going to all these doctors, they just right away ketamine out of the box, these high doses of ketamine right out of the box, and didn't necessarily throw the full court press at her. But this expert was on this stand to say that what Johns Hopkins Hospital was doing was the right thing, even though she was sheltered there. Initially, she wasn't under a shelter. There's about a 2-week period of time where she wasn't under shelter. That is claimed, she is claimed to being false in prison, including the 48 hours she was in that surveillance room, the EEG room under the closed circuit camera, I should say, not closed caption, closed circuit camera. So he said that Dr. Kirkpatrick, his use of ketamine was very premature in her case, very premature. They should have tried all of the therapies first. Another thing he mentioned, and I'm not sure why he did it, but he says ketamine is also used to control anxiety and depression. Now, are any of you out there on ketamine? I've had anxiety and depression for, oh God, 30, 40 years, and no one has ever thrown any ketamine my way. Nope. Yeah, so he said treated early, it just doesn't return. Doesn't return. Then he talked about the ketamine coma. He said that is not standard of care in the United States. Now, we already knew it was not FDA approved, and that a lot of things they do in pediatrics is not FDA approved. But you have to ask yourself, what is the standard of care? And the definition of standard of care is what are similarly situated experts in the community treating this with? What's everybody doing, you know? And everybody is not putting people in ketamine comas. Let's just say that they're throwing the full court press of therapy at them, and then low dose ketamine. He also mentioned that most pediatricians will never see a case of CRPS in their entire career. It is very, very rare. However, him being an expert and working at this world-renowned CRPS treatment center in Stanford, he sees a lot of it. He does not believe that she had CRPS. So he was asked by the cross-examination, you know, what would she need going forward in the future as a CRPS patient? What can we anticipate her future needs are going to be? And he goes, well, first of all, I don't think she has CRPS, but in any case, she's going to need psychiatric help for the rest of her life. So, okay, write the check. I don't disagree with that. And he did admit that the hospital was billing for complex regional pain syndrome. Even though he didn't think she had it, the hospital was billing for that diagnosis. Then I talked about becoming dependent on ketamine. The jury asked him about the FDA approval. That question came from the jury, where he says most things are not FDA approved in pediatrics. I thought that was very insightful of this jury, and they're asking us so many questions. So the next person on the stand is a pediatric hospitalist by the name of Dr. Dees. I want you to see this cross-examination. The direct examination is just, I'm going to skip to the cross-examination because this is where it gets really, really good. She was the one, sort of the captain of the ship, so to speak. The hospitalists, they're the ones that see the patient every day. They're the ones that, kind of run the treatment team, you know, get everybody's insight, the residents, the therapists, and she'll enter the orders. You know, captain of the ship, basically. And there was a lot of different questions about, was Sally Smith from the Department of Children and Family Services part of this treatment team? So take a listen to this cross-examination.
Afternoon.
You were previously deposed in this case. Do you recall that?
I do.
You do not have any expertise in complex regional pain syndrome, do you?
I am not like a registered expert, no, sir.
Yet you testified that under your assessment, you believed, your words, at the end, that Maya did not have CRPS. Is that right?
Correct.
When did you arrive at that determination?
I couldn't give you an exact date, I'm sorry.
Can't tell us which date?
There's no date that I decided that she did not have the diagnosis. I can say that by the end of the time I took care of her, that was my impression, yes.
So your last interaction with her, if I was following, was November 1st or 2nd?
I believe it was more like the 7th, I think.
All right, about the 7th of November, that'd be the end of your time with her, right?
Correct.
So by that point, you'd reached an opinion that Maya did not have complex regional pain syndrome.
Correct.
As part of the treatment team. You were part of the treatment team.
I was part of the treatment team.
All right,
correct.
so the jury should be looking for bills for CRPS after November 7th, correct?
I don't understand your question, I'm sorry.
All right. Now, you understand that complex regional pain syndrome is not equivalent to paralysis, right?
Correct.
So the fact that Maya could move her legs does not indicate she did not have complex regional pain syndrome.
That in and of itself, no. However, there were other factors that I took into consideration.
You also understand that crossing your legs, a child crossing their legs, is the most comfortable, the most comfortable position for a child with CRPS. Were you aware of that?
I am not aware of that being a medical standard of comfort.
You've never talked to any physical therapists about that being a common position for CRPS
I
children?
have never been told by a physical therapist that that is the most comfortable position for specifically a patient with CRPS.
All right. The 48-hour video that Maya did not consent to, that was for treatment, right?
It was more for diagnostic purposes.
All right. Where in the medical record are any notes concerning interpretation, follow-up, a report about what you learned during those 48 hours?
It was part of my overall assessment that that was part of the factors that were taken into consideration.
Nowhere in your notes do you have any findings or interpretation of what occurred inside that room in 48 hours, do you?
There was notes made while she was in the room, yes, and observations that were made and documented, yes, while she was in the room.
Let's pull up Exhibit 211, the text messages, 2116, please. And if you'd focus on the fourth text message there, if you blow that up for me. Just pull out the fourth text message and enlarge it, please. This is your text on October 19th to Dr. Sally Smith, right?
Yes.
It says staff has been making notes while watching her remotely, right?
Correct.
Why aren't the staff notes in the medical record?
I can't answer that.
We've never seen them. Have you?
No.
But this was for treatment.
No, it's for diagnosis.
Diagnosis as part of the care and treatment for Maya Kowalski while she's inside of Johns Hopkins Hospital.
Correct.
All right. And you're exchanging here text messages with Dr. Sally Smith about diagnosis for the purposes of care and treatment while Maya Kowalski's in the hospital, right?
Correct.
But your position is Sally Smith is not part of the treatment team.
Dr. Smith is not part of the treatment team.
All right. If you would please
Yeah, you're ready to coach.
review it. Recognize your name on that note.
I do.
And who's the other physician there listed with you?
Dr. Smith?
And below Doctors Deese and Sally Smith, it says okay from risk. Is risk management at Johns Hopkins Children's Hospital often making the diagnostic and treatment decisions for the patients?
No.
No?
No.
But you still maintain this is for care and treatment, this EEG video.
Yes.
What does it say there in the diagonal writing at the bottom right? Can you read that?
I have, don't know, no, was there, 709.
Let me try. Able to
Yeah,
do
I'm sorry.
when no one,
I've never seen this before, and it's not my handwriting, so I have no clue what that says.
there it is. Able to do when no one was there. Oh,
Objection
You see that?
foundation.
Sorry?
Objection foundation speculation.
Overruled. You can continue.
709 was the room you put her in, right?
That was the room she was placed in, correct?
And this note here is consistent with your rationale, right? You were trying to see what Maya could do when no one was there.
I don't understand your statement. Could you rephrase the question?
Sure. You testified earlier that you were looking for inconsistencies and movements and things that Maya said she couldn't do, but she could do, and the thought was if you put her in a room without telling her, you'd be able to see things she does when no one was there, right?
That is correct.
All right. You can zoom out for a second, please. And then October 18th and 20th, the third line down, it says, on the right side there, I don't know if you can read that, it says, to see if she can walk on her own.
Okay.
Consistent with the rationale you had for putting her in this room for 48 hours, right?
Presumably, if that's what that says, my reason for placing her in the room was not specifically to see if she could walk on her own. It was to see if she could perform any spontaneous movement of her lower extremities.
You thought, putting her in a room under video surveillance, that you would catch her doing something not knowing the hospital's watching. True?
Could you rephrase that? I'm sorry.
You thought that by putting this 10-year-old girl in this room under video surveillance, you would catch her doing something that she said she couldn't do, but she wasn't aware she was doing while the hospital was watching her.
My intent when putting her in the room was to assess what she was able to do when no one was watching her. It wasn't in an intent to trick her or to catch her doing something. It was to assess what her functional abilities were when she wasn't directly being asked to perform by a member of the medical team.
And yet, in all the notes we looked at, there's no assessment following this 48-hour video, is there?
It is included in my total assessment, yes.
By saying no acute events overnight, that's it?
No, it is in my entire assessment of the patient. It is all part of incorporated in there.
Let's go back to the text messages for a second. Again, that's 2116. Let's look at the second page, text 15. If you'll pull out text 15 and enlarge it for me, please. Here is Dr. Sally Smith to you on October 21st, right?
Okay.
And it says, probably already in progress, but get her off as many, there's a typo. Would you agree with me that meds was what is intended, as many meds as possible?
My interpretation, I agree with you that it was probably a typo, and that is probably what she was saying is meds, not mess.
All right. Removing medications from a patient. You'd agree with me that that's a treatment and care decision.
Correct.
Sally Smith's involved in this decision, is she not?
No.
She's not. She's texting you about it, but she's not involved.
She may have recommendations or suggestions, but ultimately the decision as to would be mine as the attending provider.
So you maintain, despite going back and forth with Dr. Smith on medications, that she was not part of the treatment team.
Well, as this text indicated, she suspected that we were already in the progress of doing it anyway, so she's just offering her opinion. She's not telling me what to do.
And you removed those medications too, didn't you?
The medications that were adjusted during my time as her attending physician were part of a discussion with the overall treatment plan and experts such as Dr. Hart, who is one of our consultants, our pain team, etc.
The answer is you removed her from medications during this time, right?
The answer is I would have to review the MAR specifically to know what medications were adjusted, or at least refer to my notes.
All right, let's go to the next text message. 16, would you blow that up for me? It says, yep, last med coming off today. Does that refresh your recollection?
Yes.
You did remove medications during this time.
We did adjust medications during her hospitalization, yes.
All right, if we could put up 10010426 again. And just note here, these text messages about medications were on the 21st of October.
Okay.
All right. No, 0426, please. Top line, Maya reported she's having pain all over.
Correct.
And this looks like October 18th. Let's go to 0421, please. About 3/4 of the way down, Maya continues to have pain all over. You see that?
I do.
And this note is from, if you could zoom out for a second, October 19th. If you could go to 0413, please. Complaining of pain all over, about 1/3 of the way down. You see that?
I do.
And this date, if we see it here, October 21st, the same day your text message, right?
Okay.
So you're removing her from medications, and she's telling you she has pain all over, right?
Yes.
All right. 0409, please. 22nd, next day, complains of pain all over. You'd agree?
Yes.
All right. 0405. She is hurting a lot. See that?
I do.
The 23rd?
I do.
All right. 0369. You picked her back up in the first week of November, right, as a hospitalist?
Correct.
And here, what'd she say? Complains of pain all over?
Yes.
Can we please put up 2045-024? -024. You recognize the patient bill of rights for the hospital?
I do.
Would you please take a look at number 19 there? It's at the top right.
Yes.
Maya had the right to have her pain managed, did she not?
She did.
And she told you on 1, 2, 3, 4, 5, 6 different occasions as you were removing from medications that she had pain all over, did she not?
She did.
Who's Dr. Major?
One of my colleagues, one of the hospitalists.
She's a hospitalist on service with you, right?
She was.
And she was at the time of Maya's admission in 2016?
I don't know when she took care of her in the course of Maya's hospitalization, but I do know that she took care of her during Maya's stay at some point in time, yes.
You worked with her,
Yes.
and you traded off as hospitalists on rotation during
Correct.
Maya's admission to Johns Hopkins.
And she was involved at some point in time, yes.
All right. Well, if we could put up 1002-006, which I'll represent to you as Maya's discharge note. And if you would please pull out the bottom paragraph there. And the third line down, if you'd highlight it for me. What does this say about Sally Smith as part of the treatment team?
Dr.
Objection approach.
Interesting. Now, one of the allegations is that she was kept in that surveillance room, the EEG room, which has closed circuit recording for diagnostic purposes. Like she walked right into that one, right into it. And he's like, check, next one, check, next, check. Like he was just going down. And, you know, she says she did it for diagnostic purposes, but then she does where's your observations of her during that time? Where are the notes? There aren't any. There aren't any. Then there's, he hints around about whether she's collaborating with Sally Smith to the point where the judge has to say, okay, this is getting argumentative, and he kind of stops it. And she's asked, where is anything documented in your notes of diagnostic findings during that 48 hours? And she said, oh, I put them in my general assessment. What? Your general assessment, which says nothing. Yeah. And she kept saying, you heard her rationale for it. So, I mean, and based on the jury questions, I didn't show you the jury questions, but the jury um, was very interested in the relationship between Sally Smith and these hospital employees and how closely they were working with her. They're on. They are on to this. They get it. They get it. And that whole thing about the patient's rights, I mean, that was brilliant. Show all of her notes where she says, where she's cutting and pasting from the day before that says she's got pain all over. But you're cutting down on her medication. She's got the right to be pain free. And like I said early on in the show today, whether it's complex regional pain syndrome or some fictitious disorder, this child is experiencing pain. So she needs therapy and cognitive behavioral therapy. Even if you assume it's Munchausen's by proxy, in her mind, she is having pain. Now, maybe when she's asleep, she's moving things that she couldn't move when she was awake because her mind is telling her she's in pain. I don't know. Am I making sense? So you treat them the same. And there's been testimony to that. It doesn't matter whether it's CRPS or fictitious disorder. If they're in pain, you've got to relieve the pain while you're getting them therapy and hopefully, retraining the brain to assess the pain in a different way. Anyway, I'm very curious to see how this case is going to turn out. I just can't wait. So let me know if you want to interact during the Sally Smith testimony tomorrow night, because I can arrange a live for Thursday night if you want, or I can just recap it. It's up to you. It don't matter to me. I can do it either way. All right, guys, have a great Wednesday, and I will see you tomorrow or tonight in my live, which is known as Craft With Me Wednesday, or tomorrow in Crafting the Crime Daily. Don't forget to hit that like button. It does help YouTube know that I exist, and they will recommend my video to other crafters. Yay! So we can get some more crafting ideas, because we don't have enough projects, right? I never have enough projects. Okay. Bye, everybody.